In this brief presentation, I would like to share with you my initial experience with Triodent's V3 Sectional Matrix System. When I get a new system, I have the habit of documenting the first 10 cases, which I would like to share with you. The first case I did was a first upper molar which had a carious lesion in the mesial side. In this case, we also had to do an indirect restoration in the second premolar. Usually, I do the direct restoration first and the indirect restoration afterwards, but in this case, I had to do the indirect restoration first. So you see here that after the placement of the rubber dam, we glued the indirect restoration on the premolar, and we finished and polished the restoration, and thereafter we went to the direct restoration in the molar side. Here you see the placement of the sectional matrix, which is holding to place with the green with the universal V3 ring. You see how well it adapts, and the perfect adaptation in the cervical part. You see here I used the old V wedge because I've been accustomed to using them, so I didn't switch directly to the wave wedge, which I really like. So you see here the new system matrix and the V-ring, but with the old wedge, and you can see how well the matrix system adapts to the tooth surface, and you can visualize how well the composites will adapt to it and to the tooth. And this you can see in this slide. I will not go into detail about the bonding procedures or the layering technique that was used in each case, but what you can very easily see how well the sectional matrix system helps us to adapt the composite to the tooth surface, and this you can also see just after the removal of the sectional matrix how well it adapts, and we have just a little bit of access to the lingual and buccal side. This is what we need to do a perfect finishing and polishing of the restoration, and here you see the final result. Now, I don't want to go into detail. I don't want to say whether it was a good or a bad case, but usually it takes me about an hour to do an indirect restoration. So to finish in about 66 minutes, both restoration and photograph and document all the cases, this is a little bit quickly for me. So it was clearly a case that the matrix system helped me a lot achieve the perfect anatomy in the difficult proximal part of a class 2 restoration. And as you can see, this was not the case in the previous case when this lower molar was done. You see we don't have a perfect anatomy in the mesial side, and that was the reason for replacing this restoration. We see after caries removal and placement of the rubber dam. Once again, here I used the wave wedge. You can see the purple wave wedge, and once again you can see that the sectional matrix system is quite perfectly positioned and held into place with the V-ring, the universal, the green one, that slightly separates, and the wave wedge helps secure a perfect contact at the cervical part of our proximal box, and it's a little bit, we wanted it to be a little bit thinner. This is due to the wave side, and to the buccal and lingual side it's a little bit wider so that we can have a perfect fit. Here we see the placement of the bond, and just after removal of the sectional matrix, we see once again that we have the minimum amount of access in the lingual and buccal side of our restoration. So once again, this is very easy to finish. In this case, we see it took us about 45 minutes, but we had to do 2 restorations, one in the mesial of the first molar and the occlusal of the second molar. These occlusal restorations are quite easy. We see it was an easy one, and I really think that the sectional matrix system, the V3, helped me achieve the perfect anatomy in the proximal side, so we can have a very good result in a reasonable amount of time. The third case was in a patient that had periodontal involvement, and we had to replace this amalgam restoration in the second premolar. We see here after the removal of the caries, the cavity preparation, the placement of the rubber dam, And here you see that we had to use the third size of the wave wedge because we had a rather large cervical embrasure due to the tissue loss because of the perio disease. And once again, we can perfectly see that the wedge helps us have a perfect adaptation of the sectional matrix system at the cervical part of our cavity preparation, and the V-ring, the yellow one, sorry, the green universal ring helps us position the sectional matrix exactly where we want to. And as it's illustrated in this picture, we can see just after placement of the composite, then when we remove the sectional matrix, once again we have perfect adaptation in the proximal area and just a little bit of access in the lingual and buccal side, which is extremely easy to finish. Here you cannot see very well. Unfortunately, I was a little bit quickly with the photograph. We see a little bit of saliva, but the adaptation was quite perfect. Now, the fourth case was a little bit more demanding in the sense that the patient had orthodontic treatment, and we see that the molar is slightly rotated, so we don't have the usual contact in the proximal area. So after removal of the previous restoration and caries, we see we sandblasted the surface to have a perfect bonding then after, and we see that the embrasure in the lingual side is a little bit larger than in the buccal, again, once again, due to the rotation of the tooth. We place the rubber dam. We see like the size of the restoration is quite medium, it's not a problem, but the rotation of the tooth makes us a little bit of difficulty. Now, the sectional matrix is very easy to be placed into position and follows the normal curvature of the tooth, but when we see when we place it, we have a little bit of opening in the on the cervical side of the box, that the white ring, when we put it, it seems okay, but then when we place the ring, we have a large opening. I don't have this picture, but we can see the same thing with the larger size ring. It's held into position, but when we place the V-ring, we have an opening, and this is due to the fact that the patient had orthodontic treatment, so the teeth are more mobile than we would expect. So for this reason, we had to go to once again to the larger ring, which was, again, we had an opening, so we had to combine the white and the purple, the deep purple ring, to have a smaller opening. Now, at this point, we focus our attention in the posterior tooth, which had an occlusal cavity. We finish it, and while we do that, we want to make sure that we don't desiccate the tooth. So that's the reason why we had a wet cotton roll in the cavity of the molar, and we place our bonding agent and a little bit of composite to the, of course we cure, then we put our first layer at the cervical box, and then we build the enamel in the proximal side, and we do a regular layering, a little bit of flowable, and then oblique layering to the buccal, and then the lingual side, and then all of it in the occlusal. So it's a rather simplified technique, and we see here the finished restoration. Now, what is important is that usually the V-ring separates the teeth just as we'd like, but so we have a rather good contact point. In this case and in some others, we see if the teeth are a little bit mobile, that it's quite difficult to remove the sectional matrix with a normal plier, so we have to use a mosquito to remove it, and this is what we want because we want to have a really tight contact area. Sometimes we can remove it from the lingual buccal side, from the buccal side, or from the occlusal, as we did in this area, but we see it's very clearly seen that with the V3 Sectional Matrix System, it's quite easy to achieve a perfect and tight contact point. Here we see after the removal of our sectional matrix, again, the perfect adaptation, and we have just a little bit of access to the lingual and buccal side. This is what we need. We do the final polymerization with our glycerin gel, and we see here just a little bit after removal of the rubber dam, We haven't finished, of course, the restoration. We haven't done any polishing, but we see how well the restoration adapts to the tooth surface, and this little bit wide opening in the embrasure is due to our wedge, that when we see the recoil, it's perfectly adapted and we have no problem as it was seen in the previous case. So once again, the V3 Sectional Matrix System helped us achieve the quite nice anatomy in the proximal difficult area. Now in the occlusal side, we see that we could have used a little bit nicer color of composite. This is not the perfect color match, which is not important. The important for health reason is we see that we restore a much more normal anatomy in the proximal area in the mesial side of this first molar. Now the next case was an easy case. It was a very small cavity in the distal of this premolar, and we always start. We don't go to the proximal side. We start from a little bit in the inside of the tooth, and we can see very easily that we had caries underneath. It's quite easy to remove them without touching the proximal side of the adjacent tooth. Then we go on with a hand instrument and we break the remaining tooth structure, and we go on to finishing our cavity. Now, I don't like to work without a rubber dam, but in this case I was extremely out of the schedule, and the gum situation of the patient was quite healthy. So we see here, after placement of the sectional matrix and the yellow, the narrow ring, we see that we have a perfect adaptation, and even though I don't use a rubber dam, we can see that it's so perfectly adapted that we will not have any problem with moisture. We have a perfect control of the operative field. So we go on with doing our etching and our bonding and our layering of the composite. And here we see that was a small restoration. We didn't have a problem with the gums. We used the white wave wedge. And we see that just after placement of the wedge, once again, we have a rather good adaptation with just a little bit of access as we would like in the buccal and lingual side. So we have very little time to give to our finishing and polishing of the restoration. So as you can see here, in less than 3/4 of an hour and taking pictures of all the stages, we will finish, which is, I think, a reasonable time in the daily routine in our dental practices. The next case, we had to do 2 adjacent restoration. Now this you can do both ways. You can do both simultaneously. I like to do one at a time. So in this case, we started with the mesial, with the distal restoration of the mesial tooth of the first premolar. We place the rubber dam. We see here the finished cavity, and because we used that narrow teeth because the teeth were relatively short. So we see here once again with the white wedge, the veering helps us keep the sectional matrix in place exactly where we want it. So you can once again envision that the area for the composite is nearly perfect. So it's quite easy for us. We do our regular bonding procedure and we place the composite. Here was a small cavity. We did horizontal layering, and after the removal, you see once again that we have a little bit of access to work on the difficult areas in the proximal side. We had a little bit more composite in the occlusal side, but it's quite easy to finish. So we go on, we finish our restoration, the most of it, and then I will go to the next restoration, to the mesial side of the second premolar. We remove carefully the amalgam and the caries, and then we finish our restoration. I will not go into too much detail to that. And then the placement of the veering. This is a little bit of a larger cavity. We see once again, we can envision that the placement of the sectional matrix with the wedge and the ring helps us have the perfect shape of the tooth that we would like to fill in with the composite. As you can see here, the placement of the composite, and just after the removal of the sectional matrix, we just see that we have minimum amount of access in the lingual and buccal side, and the proximal side is nearly perfect. So we have to give a very little bit minimum amount of time in finishing and polishing. And here you can see the finished results. Actually, we did like 2 restorations in less than an hour, 2 separate restorations in less than an hour, which is, I think, once again, a reasonable time for our daily routine in our dental practices. Now, the next case was a little bit of a funny looking restoration, because the adjacent crown of the tooth was a little bit awkward looking, but we had caries. We had to remove it carefully not to damage the adjacent tooth. We see once again that the 3D curvature of the matrix system helps us very much go into place, and the universal, the green ring, helps us position it perfectly. In this case, we could not put a wedge due to the funny morphology of the adjacent tooth, but it helps us stay in perfect position. And you can see here that after placement of the composite and removing the access, once again, we have a minimum amount of access to remove a little bit of the lingual to the buccal side, and it's quite easy to finish our restoration. And here you see the finished result. Once again, I don't want to brag or say whether this is a nice or not a less nice restoration. I don't think it's the most beautiful restoration in the world, but once again, in a reasonable amount of time, we can have a quite decent result, I think. And this brings me to this, to the 8th case, which was an upper second molar. It's one of these cases that you can see in the X-ray, and the patient has a little bit of pain, and that you have caries in the cervical side of our, in the mesial side, and your heart, breaks when you want to go from the occlusal side and, let's say, destroy this part of the tooth in order to reach the caries lesion at the bottom. But you have to do it, and this is a turning point when you have a system that you feel so confident with it when using it, that you saw that you will restore it perfectly. It's very nice, and this is clearly illustrated in this case that we did our initial preparation. We had removed the caries, and then we had to finish the restoration. That was minimum opening, and for the finishing of the proximal areas, we used the ultrasonic tips, which helps us finish our proximal margins without damaging the neighboring tooth. And here we had perfect gum position, and we see how the placement of our sectional matrix, with the help of the white wedge and the weight wedge and the universal ring, helps us have perfect position. And then it's quite easy after removal of, we see here, when we just remove the sectional matrix, we see that we have a minimum amount of time to use. We see here how we adjusted the occlusion, and here the final result in a very, very logical amount of time. We did, I think, good clinical everyday dentistry. Now, coming to the end, this is a case of a first upper molar. We had to do both the molar, and we had to replace the premolar. We see a little bit of a funny morphology in the proximal sides. So we start with the molar, once again from the inside of the restoration, because we don't want to damage the adjacent tooth. Even if we know that we have to replace it, I prefer not to damage the adjacent tooth and go one at a time, but this is a personal preference. You can do either way, I think. And we use the wedge guard here. We place it between the teeth, which is very, very practical, so that when we go and removing the amalgam, the proximal side, we see here the removal, we do not damage the adjacent tooth. We may touch a little bit the wedge guard and the metal matrix there, but we will not damage the adjacent tooth, regardless if it's an amalgam that will be changed or a virgin tooth. I like to do that. And now we had to finish again the margins. We use on a regular basis the ultrasonic tips, as you can see here, and you see here the finished margins. So the next step would be placement of the rubber dam, and of the sectional matrix system with the help of the wave wedge. Now, if you see here, I haven't positioned the V3 ring in place. In this case, it would be the yellow one because we had shorted, but I didn't place it because I don't want to separate the tooth because I will do the premolar at the second stage. So I'm just focusing in perfect anatomy of the molar at this stage. So we do, and this teeth we see we had a little bit of crack, that's why the tooth was sensitive. So we do a little bit of enamel etching, then we use a self-etching primer for denting, and a little bit of floorball in the axon area like a liner. Then a little bit less than 1 millimeter composite in the proximal side at the cervical area of our preparation. Then it's a regular procedure, I don't want to go into detail. Then we build the proximal enamel, and then in 2 layers, first dentin and then enamel the rest of the restoration. And upon removal of the wedge, of the sectional matrix and the wedge, we see once again how we have restored the anatomy of the tooth where we would like, with just a little bit of access to the lingual and buccal side, which is very easy to work with. Here we see the final polymerization with glycerin, and when we finish our restoration, we see that this is ideal where we would like to have the molar. Here we see it finished, and from the buccal side. Now, of course, we have to go on for the premolar at the second appointment due to our schedule. But once again, we see that in a relatively logical amount of time, in less than 45 minutes, because in the digital photographs, and of course, these are at everybody's disposal, you can see the time, and you can see that it took us about 3/4 of an hour from start to finish, and taking pictures of all the different stages. So I think this is good. Which brings us to the last case, where we had a caries lesion in the distal area of the first molar and a little bit in the mesial side of the second molar. So we see the cavity preparation, and we see the small lesion in the mesial side of the second molar. So we place a rubber dam, and I have the habit of finishing the one restoration and then going to the other one. So in order to do that, we use the wedge guard to protect the adjacent tooth while we do our etching and bonding procedure. When we place our restoration, I'm not going into detail. And we see here you can use the EVA contrangle to finish the proximal cervical side of the second molar, and with regular sandpaper or plastic discs, we finish our proximal side, and then we go to restore the distal side of the first molar. The teeth we could use, I prefer to use in this case the green ring, because it gave me better positioning of the sectional matrix, which was held also with a medium-sized wave wedge. And once again, you can see that the way the sectional matrix is placed, it gives us more or less the ideal area for our composite then to be placed. Here we see just after placement of our restoration and final curing, and when we remove the wedge, we see that we have nearly ideal morphology with just a tiny little bit of excess in the lingual and buccal side, and here we see the restoration after occlusal adjustment and the final restoration. Now, I think this is the end of the presentation, and once again, I don't want to tell you whether this was good or medium or, let's say, bad restoration, what you saw, but I wanted to share with you my first experience with the V3 Sectional Matrix System, which I think that it would be something good to try with and have it to the armamentarium of your private practice. Thank you very much for your attention.